lighting your way to recovery.
The pandemic has certainly introduced a whole host of problems and struggles for individuals with eating disorders.
We see across the board an intense demand for services, but unfortunately we just don't see in the community the resources available to meet that need, which is why it's so exciting that we're able to expand our services to adolescents and adults who are, recognizing that they need some more intensive support right now. And so we'll be able to accommodate that growing demand for mental health services.
The patients at times need a more intensive service than what the day program can afford. So they need more medical monitoring, they need more oversight, they need an environment that's 24/7 supporting them and not acting on their eating disorder. And the residential care allows them to have that environment, but it also allows them to practice being in the community so that during residential care, you're able to have outings, you're able to do things to practice the skills you're learning. The staff is really trained to help individuals recognize their impulses and put into motion the coping skills that they're learning to manage those impulses so that when they step down to the day program level of care, they're ready to manage the evening hours and the nighttime successfully so they're not acting on their impulses.
Historically in Maryland, there's been a lot of use of hospitalization for people with severe illness, and a goal is to try to avert hospitalization by catching things earlier and having a full range of a continuum of care. And residential services, generally, there haven't been a whole lot in Maryland, so this is going to be a new element that I'm really hoping will fill a void. With 101 shilling for PHP and IOP treatment right next door to our residential facility, which will treat children, adolescents, and adults requiring round-the-clock monitoring and round-the-clock care, is going to be very convenient for patients. They'll be able to have the same treatment team in both locations, so if someone is needing to move to a higher level of care, they'll be working with the same clinical team. Conversely, patients who are ready to be in a less intensive environment will be able to come to 101 Shilling right next door and work with the same group of professionals.
Another important point is, parents and family are really a critical component of treatment. And so to have the residential care here in the state of Maryland, where families can be actively involved in the day-to-day care and come visit their loved one and also be in the family therapy and practice family-based treatment meals with the patient, really is just unbelievably a major asset to supporting success in the treatment of these individuals.
The space here is, I think, ideal. It's bright, it's got lots of light, it's got skylights, it's got large rooms that are extremely comfortable, nature-based artwork throughout. One of the new features to our residential eating disorder facility is this beautiful teaching kitchen. It's really, really a great opportunity for our dietitians to have the group of the patients in there and provide education and hands-on practicing with, food preparation and cooking, and just the exposure to handling food and doing that together as a group is just a major asset to the program.
We wanted to draw in features of Maryland, and so kind of picking out waterways and local, plants and things, I think that really helps to kind of make it feel a little bit more closer to home too.